This is Jefferson Close-Up. I'm Carol Celine. My guest today is Dr. Tsao-Wei Liang.
Hi, how are you?
Hi. Now, you were telling me that your parents came here from South Jersey from Taiwan when you were like a little kid, 2 years old, and that you kind of grew up like any other American kid, except for one thing, you had a twin brother. So I was kind of curious, did you fight a lot or were you best buddies?
We were neither. I think we actually pushed each other in a lot of ways. What he did, I wanted to do. What I did, he wanted to do. And my parents didn't actually have to push us too much through school and everything. And finally in junior high school and high school, we decided to go our separate ways, and he ended up leaning towards music, and I leaned towards the arts, painting and so on, and we sort of made our mark in high school and in school that way.
So do you have a treasured memory from childhood?
With the recent snows, I realized that I probably do have one, and that my wife and neighbors were wondering why I was shoveling all the snow into piles in my front yard and building little igloos for my 2.5-year-old son, and I realized that was probably one of my fondest memories of childhood.
Now, your specialty is neurology, and your particular focus is movement disorders. What pulled you into that direction?
Well, I always felt that I was interested in and fascinated by the brain and neurosciences. And in college, I had the opportunity to work with a neurologist who was a movement disorder specialist at Johns Hopkins Hospital. And even to this day, I still think of him as my idol, so to speak, because he has really shaped the way I feel medicine should be practiced. And that's where I think it started.
Now, the majority of your patients have Parkinson's disease, and I was interested in what are some of the symptoms of that disease that should alert people to give a neurologist like you a call.
Sure. Most people recognize Parkinson's disease as a disorder of tremor and problems with mobility. The 4 cardinal features of Parkinson's disease include a tremor, and a very typical tremor, which we call a resting tremor, when the hand is relaxed. It begins
so
to
I'd
shake.
be sitting here and going like this?
Yes, that's one. Number 2 is slowed movements or bradykinesia, muscular rigidity in the wrist or the elbow or the leg, and a typical walking pattern or problems with gait.
Are there any cutting-edge surgical techniques?
We are using a technique called deep brain stimulation, which has been in use for over 10 years. And deep brain stimulation is a therapy, in essence, electrical stimulation for the brain that modulates the way a person, let's say with Parkinson's disease, behaves and moves.
Now, is this a one-time thing, or do you carry a pack with you that's constantly stimulating the brain?
Right, so there is a pacemaker-like device that is implanted in the chest wall. And there's also an electrode that's implanted deep into the brain that regulates signals. And they are connected by a long wire. And the stimulation is carried along that wire into the brain. And what is neat about it is I can go in with my handheld programmer, I can go in and adjust the stimulation parameters to find the best combination of parameters for that patient. I think with what I've seen, even in the few years that I've been practicing Parkinson's disease therapy, I've seen major advances, and I only see the future brighter for patients with Parkinson's disease, especially with all the celebrities that are behind the cause at this point.
Well, I think we'll end on that encouraging note. Thanks so much for joining us.
Thank you for having me.